first patient of the day. This patient came to see Dr. Jeneby for a tummy tuck, or a revision of a tummy tuck that she had in the past. She's also going to get a Mons lift and a brachioplasty. So Dr. J and Dr. Phillips got started on the patient liposuction. As you can hear, Dr. Phillips is doing some vaser right now. We're also on YouTube, so if you guys would like to see what's going on in the OR, please join us over there. Hey, Yvette, what's the price for Lipo 360? Great question. It's not as expensive as as our other procedures are, just because it's quick, it's easy. However, patient to patient, it's going to vary because some patients have more fat than others, and therefore more time is kind of put towards getting that fat removed, if that makes sense. And in certain areas, like if they have to flip you over during surgery, it just kind of depends. You can expect to pay, I want to say like over $2,000, but I'm not completely sure. Go ahead and put a form that you can decide to fill out if you want. Through this form, you will be provided a free quote for Lipo 360. So how it works is you'll fill it out, you'll submit it, and then someone from our team will reach back out to you, and they'll either text you, email you, call you, whatever works best for you, and they'll be able to provide you with a quote for Lipo 360, if it's just Lipo 360, or provide you with a quote for other surgeries that you're interested in. So it takes 1 minute to fill that out, or if you can leave your private information through a text, like a private message, and we'll get back to you on that. Let me know if you have any more questions for that. But again, Dr. J and Dr. Phillips are in surgery, just getting started this morning. The patient that they're with right now came in for a brachioplasty, which is an arm lift, some liposuction, and a revision of a tummy tuck that she had, I'm guessing a few years ago. I love my surgery with Dr. Jeneby. Can't wait for another barrel. That's awesome. What did you have done? I'm glad you had a good experience. We love to hear y'all's feedback, so I'm going to go ahead and screenshot that. And then we like to show Dr. J. And you can always reach back out to us if you're ready to book with us again through the number that was provided to you, or again by filling out this form here again on the bottom of your screen. And for those of y'all that are not aware, we are on YouTube, so we are showing this patient's procedure on YouTube. The restrictions for live are a little bit different. You can show a lot more because the filtering process over there is a lot more, it filters out better for the audience that is trying to reach, if that makes sense. So we have flipped the camera over there on YouTube, and you're able to see the surgery. So you can see there on Dr. Phillips' side that he's doing some liposuction. Hey Beryl, I see you commented. How long do I have to wait? I had my surgery June 9th. I want to plan a tummy tuck for June 2026. Yeah, Vero. So I think that is totally possible. What procedures have you already had done? Depending on the extremity of them, it could interfere with your. It wouldn't interfere. It would just be good to know for something like a tummy tuck, because usually, like, if you go in for another surgery, the minimum or what's recommended is that you wait 6 months before you go in for another invasive procedure like that. But we can set up a consultation and determine whether or not you're fit for another surgery like a tummy tuck. But again, what surgeries have you did you have done this summer? Because the healing time is different for every surgery, and again, each person's healing is different. They take a different journey for each individual person. Liposuction, yeah, Vero, you should be totally and completely fine. The recommended wait is about 6 months after your initial surgery, just so your body has completely healed and there's no big risk going into surgery. Since we waited the appropriate amount of time for your body to completely heal. So you should be totally and completely fine to book in June. Would you like me to help you set that up? And again, for those of y'all just joining, Dr. Jeneby and Dr. Phillips are currently in surgery right now with this lovely patient. Came in for a brachioplasty, which is an arm lift, and a revision of a tummy tuck. So as you can see, Dr. J is on the patient's left arm now. Getting started on the brachioplasty.
What's your local basically? Silent pain with Crawford?
Yeah, Vero. So I would love to help you. I'm going to direct you first to filling out this form here on the bottom of your screen. Let me know if you see it. It's going to pop up as a white little dot, or excuse me, a blue little dot. Let me know if you see it. And from there, you will leave your information, and you will submit it, and then I will go in and take whatever information you provided and send it over to someone on our team that will reach back out to you. How expensive is the surgery? Yeah, Lori, we'd love to set you up with a quote. If there's anything specific that you're interested in knowing, like the price of, you can comment that, or you can fill out this form here on the bottom of your screen, and through that form, once somebody goes over your information, they'll reach back out to you and they can provide you with a more detailed quote for all the specifics, go through all the specifics with you about the surgery you're interested in, about pricing information. Do BBL cause blood clots after surgery? Yeah, Carrillo, no. That would cause a lot of concern for surgeries. We would not do it if it was that dangerous. If you are a smoker, if you smoke cigarettes, if you smoke weed, if you're drinking, that will put you in a bracket of high concern, if that makes sense, or high risk of getting blood clots. You know, there's some other things also that will contribute to it. If you're not moving around, it can. But there's always risk in any kind of surgery, but it's not very likely that that will ever happen. It's more likely, though, if you are smoking before and after surgery, that you'll get a blood clot, and if you're not moving around. So that's why Dr. J, if somebody, we go through a lot of drug tests. That's why if somebody tests positive for like nicotine or cannabis, like THC, and alcohol and whatnot, Dr. J will have to delay their surgery until it's not found in their blood, not found in their system. Yeah, Carrillo, how old are you, if you don't mind me asking? Because not that I'm brushing it off whatsoever with age, but you know, as people get older, there is a higher risk of complications, you know. So I'm just curious to see how old you are, and also if you're not necessarily the healthiest person. Again, like not saying that that would give means to blood clots, but that could be a potential reason. I'm really sorry to hear that though. That's really scary. And what kind of surgeries were they? Were they cosmetic, plastic surgery, or were they like necessary procedures that you had to have done? You know, because everything here is, it's not, there's not like a sense of urgency to get these procedures done. It's for aesthetics mainly, which is very important, but still, it's not as important as like open heart surgery or something like that. Well, let me know if you guys have any questions. So we're still in surgery right now, Dr. J and Dr. Phillips. Right now, working on that brachioplasty, which is just that arm lift, as you can see there. Oh, wow. I'm really sorry to hear that. This pregnancy. Yeah, I'm not sure. Have you had any, like, is your medical history, have you had like a lot of problems in the past? Have the doctors ever like discussed anything that may be abnormal with you about your health that are maybe signs for concern? Hey Anna, how long is the surgery right now? Yeah, so since Dr. J and Dr. Phillips are in the OR together today, it's gonna go by quicker than usual. This patient is having a brachioplasty done and a revision of a tummy tuck with some liposuction in various areas. So a brachioplasty, that arm lift, is going to take a while because if you look on YouTube, that incision is from the armpit all the way down to the elbow. And so that's a lot that has to be sutured up, you know, and that can take a while because it can, you know, it's your arm, like it has to be pretty precise. And with there also being a revision of a tummy tuck today, like that will also take some time. We've already been live for about 15 minutes. They got started a little bit before, but I reckon it'll probably take another hour. I have no clotting factors. Doctors said it was just the major surgery since I lost loads of blood. Okay, well that can kind of make sense. Nonetheless, I'm still really sorry for you. That's really unfortunate. Hoping I can get surgery one day. Yeah, well, like I said, we go through a series of tests. If there's anything that Dr. J notices that's very concerning, like he'll send you off to get cleared by other doctors. So like if he suspects like you are having heart problems or if you're on any kind of some medications, Dr. J will get you cleared. So we go through like a screening basically to make sure you're eligible for surgery first, just to make sure you're healthy and it's not going to put you in harm's way or us either, because we don't want you to, I guess, be in trouble in our hands, if that makes sense. But yeah, we can help you get cleared. Again, like I'm going to direct you to this form right here that you see on the bottom of your screen. If you ever want to consult with us, we'd love to get in touch with you. We offer virtual and in-person consultations. And from there, we can really see if surgery is a good option for you, if that's a viable option. So go ahead and fill that out if you like. Hey Anna, for arms, yeah, for the arms, it's gonna take like, if it were just the arms, nothing else, it'd probably take an hour, to be honest. But that's it, maybe an hour and a half, depending on how much is removed from the patient's arm, if that makes sense, like how much they have to cut off, like how much skin and how much fat they have to cut off and lipo off. Great question though. Brachioplasty I guess you could say they're more, if it's just brachioplasty, they kind of take a while. But yeah, let me know if you guys have any more questions. As mentioned, we'll be live here for the majority of the surgery. Got a couple of surgeries going on today. So we'll go live for those. Depends with what surgeon you go with also, Anna. More than 3 hours. It depends, honestly. The Dr. J, it's not going to take that long. But with other surgeons, it might take that long. Sometimes there's a surgical tech, sometimes there's not. And so with that being said, the surgery can go either a lot faster or a lot slower if there is that extra person in the room or not. But Dr. J usually has a surgical tech with him, and like today, there's Dr. Phillips as well. So another plastic surgeon, so that goes by a lot quicker. So again, it depends who you book and have your surgery with. We're on. But like mentioned, this patient with Dr. J is operating right now. Came in to see Dr. J for lipo in various areas, ass with legs. She should be. Yeah.
Where she's at? Because there's a guy here that's going to do like an in-service. I wanted to see if they can film it, like make a video.
Let me text her.
Tell her if she's here, whatever, she can meet us like just here at the front nurse's station at Maximus.
Okay. Yeah. You remember her? Hey all, for U25, I leave for Florida tomorrow. I'm having lipo 316 arm lipo surgery Friday. I'm excited. Well, good for you. I mean, it's all for U25. That's so exciting. I hope your results are exactly what you envisioned. Yes, during surgeries like this, we do, because it's so invasive and whatnot that they kind of, well, yes, they do. I'm not exactly sure all of the specifics, but when they're under general and they're this invasive, yes. Maybe John said there is a invoice that they are going to do, period, at Maximus, period, and wanted to see if you want to film it, question mark. He said, if yes, comma, meet at the nurse's station at Maximus, period.
Really? Okay, so we got tonight.
Film.
First, next week, let's go first. If you can't, let me know, it's okay. You know what I mean? Yesterday we went out to dinner and we, for Dave, you know? He's gonna be here Thursday, Friday, Saturday. We have nothing here for the ASA. Also, my good friend's wife is coming. Need you that. I told you about this week. The ninth, so extra. Yeah. You can, and Thursday. So I have to, when we go out Saturday, so you guys can go out Saturday. Yeah, that'd be, we can do her. Or you could be the place Friday, but I'm going to say, you know, be in the, I don't know, 7th or 27th.
Again, we're showing this surgery on YouTube. You can join us over there if you'd like. If y'all have any questions, you can just leave them here. Dr. J and Dr. Phillips are currently in surgery right now. This patient, again, came to see Dr. J for a brachioplasty, which is just an arm lift, and a revision of a tummy tuck. So if you guys have any questions, just leave them here. We'll be live for a little while longer. We've already been in for about 20 minutes, 25 minutes. So we'll be live for a little while longer. Dr. Phillips has his own case later on this morning, and so does Dr. Barlow. If you guys don't follow them yet, I would highly recommend. You can find Dr. Phillips at Dr. Band, and he'll likely go live for his patient's case. So what you'll see on the YouTube live, the stitches going in, the sutures for this patient's plasty, so that one.
That little brand called Borat. Yeah. Remember that? It was Borat, but maybe going on. Ball.
So again, Dr. Jane, Dr. Miller starting surgery. Let me know if you guys have any questions. We're on YouTube, so if you guys would rather see it, you can join us over there as well. It's going to be linked in our link tree. You'll find it all the way on the bottom. Just look for the YouTube icon, click on it, and it'll send you right over, or you can search for it at Dr. Jeneby Plastic Surgery. You can watch there. Got a couple more cases going on later today. Dr. Phillips has a case, and then Dr. Barlow has a case as well that we will go live during. Dr. J is now on this patient's monslip, which is that lower portion of the stomach. This patient already had a tummy tuck, but Dr. J is just going in and doing the monslip for this patient and revising the scarring a little bit from her previous tummy tuck. So again, let me know if you have any questions. Or if you'd like to get in contact with our team, y'all can fill out this form that we have pinned here on the bottom of your screen. And from there, we'll get in contact with you. Hey Gabby, thanks for joining us on YouTube. How are you? Alright, you guys. I'm gonna wrap it up shortly. Let me know if you guys have any questions before we get off. We'll go live for Dr. Phillips' case. So if you guys have any questions in the meantime, you guys can always leave us a private message through our social media. They're all open. Or you guys can give us your information through this form that we have pinned here on the bottom of your screen so we can get in contact with you.
So it first said under 130, it said 70. They said under 100 in the 90s and 2000. Then they went under 70 in the last 10 years. So they're once you go to 70. Oh yeah, you're LDL. Right. Under 70 now. We don't deposit plaque. That means it's worth your health, man. Brain.
Huh? Again, this patient that Dr. J and Phillips are operating on came in to see him for a brachioplasty, which is that arm lift, and a Mons lift. So that's a revision of a tummy tuck. This is a fleur de lis. So what that looks like is pulling the sides and the bottom together in the middle, essentially. And we're on YouTube, so we're showing that, showing the surgery. Alright, y'all, we're going to go ahead and take a break. We'll be back, though, for some of the other cases that we have going on today. In the meantime, if you guys have any questions about the specials we have going on, questions about pricing, like to get in contact with our team, I'm going to direct you to this form here on the bottom of your screen, or it's linked in our profile. It's our Get a Quote form. You guys can fill that out, submit it. Someone from our team will reach back out to you, and from there we can do a conversation, basically give you all the info about the procedures that you're interested in. And until the next surgery, we'll see y'all in a little bit.